Welcome back, everyone, to another exciting of We Heart Therapy. I'm your host, Annabelle Bugatti, and today we're having a special topic where we are discussing getting therapy for PTSD, specifically for veterans in our armed services. And with me, I have special guests with us. We have Catherine McConnell. She's a therapist in Texas, and she's going to talk to us about therapy around PTSD. So thank you, Catherine, so much for joining us today.
Hi.
All right. So, Catherine, can you talk to our viewers a little bit more about exactly what PTSD is?
Yes, PTSD is the acronym we use for post-traumatic stress disorder. So it's actually sort of under the cluster of anxiety disorders. What it is the normal response to trauma that we have when something bad happens, fight or flight response, being aware of our surroundings, worried about predators. Those things in our brain kick in, and we need that. But after a certain period of time, if it doesn't turn off, it becomes problematic and you can get stuck. And it can cause, sorry, go ahead.
So it sounds like, when something really traumatic happens, people sort of get stuck in that place where the trauma happened, and it's hard for them to lead a normal life.
Yes, it can really, really interfere with quality of life and become a big problem.
So why is it important for folks to see somebody about the PTSD?
Well, it's uncomfortable, first of all. It can affect them in ways they don't realize. I see a lot of guys that get sent to anger management when really that's anxiety manifesting as anger. That's the fight or flight response, feeling threatened. A lot of them don't know why they're so angry. It can affect relationships. You can get triggered by certain things, start yelling at your spouse or your kids, lack of patience. Some guys have even, unfortunately, gotten discharged for behaviors that are directly related to post-traumatic stress. So it can really affect reintegration and kind of everyday life without you realizing it.
Yeah. So, and I know something I've worked with quite a few soldiers, and a lot of them are very reluctant to get any sort of therapy or counseling that's on the record because they're afraid that it's going to interfere with their employment. But at the same time, if they don't get help, it surely can cost them their career in the military, right?
Absolutely, absolutely.
So can you talk to those veterans or those folks who might currently be serving who think that they might be struggling, but they're a little reluctant to get help for that?
Sure. So the first thing I would say is that I give the analogy of a broken arm. These guys don't have trouble going for physical issues. And what a lot of them don't realize is that PTSD is a physical issue. There are hormones that are released. Parts of the brain get triggered. It is a physical issue as well as an emotional one. And sometimes that helps them understand a little better. It's common with war. War is an artificial environment for humans. It's not a weakness to not know how to deal with that, particularly those guys that get out after a deployment and they don't have the resources that they might have on a base, the brotherhood, the people that understand. The sooner it's treated, the better the prognosis is, meaning the outcome. The sooner it's treated, the less you're going to get stuck. It may not be PTSD. It may be what we call acute stress, which is the first phase. So I would encourage them to get help as quickly as possible.
And there are some services, I've heard that there's some military services on base that are actually off the record, but there are also private pay therapists that, if maybe they don't feel comfortable seeking help on base, they could go off base and see a therapist off the record.
Right. So there's behavioral health units on base if they want to go that route, if they're okay with that. Everybody knows about the VA. There's a lot surrounding that. Some of the guys don't want to go there. There are civilian therapists like me that specialize in this, and many of us know the culture, and they don't have to explain as much, but we can be a little hard to find. So, do you want me to go into how to find us? Is that okay?
How can they find somebody in their area if, they are in an area where it might be difficult to find somebody? How can they go about finding a therapist who will help them off the record?
Sure. So a lot of the civilian therapists are on psychologytoday.com. That's where a lot of us hang out. You can find us. That can be a little overwhelming sometimes. Military One Source is a well-known military based sort of help line, and that's on base. You can find people that are near base, family services for your kids, all of it. Givenhour.org is a good one, and that's actually a lot of therapists will see soldiers pro bono are free. So that's another good resource, particularly if you're worried about finances. Don't let that stop you from finding help. There's also Veterans Crisis Line, which is 800-273-8255. It's marketed as a suicide hotline, but they can also help you get hooked up with services. And then there's an all-encompassing military one called maketheconnection.net. So there's a lot of resources out there. The hard part is a lot of guys don't know how to find us.
Right, right. And that's so valuable. And I like that you said that there's a lot of free resources for veterans, and a lot of them don't realize that there are therapists and programs out there that do pro bono work specifically for veterans. So
yes.
That's pretty awesome. So if they are looking to go to therapy to work on their PTSD or whatever's going on, what type of models of therapy do most therapists use to treat PTSD and would be helpful for them to look for?
Sure. So a really popular one is eye movement desensitization reprocessing. You'll see it called EMDR. It's a little gentler model. It can feel a little strange. We kind of walk you through thinking patterns and things like that. A lot of people confuse it with hypnosis. They're a little different. I'm not going to go into all the details right now, but it's a really
a lot different.
Yeah, it's very, very different. It's a really good therapy. Cognitive processing therapy is my favorite. That's that, and coupled with the EMDR, those are the two that I use the most. It's a gentler therapy. Cognitive behavioral helps you work through thinking patterns and challenging thoughts that we call stuck points. The world is not safe. It was my fault. Things like that. It's a little gentler because you only have to go through the trauma once or twice. You're not reliving everything. And our goal is not to re-traumatize. You know, the older methods, people would have to go through the traumas in detail. We try not to do that now. Also, acceptance and commitment therapy is another one, sort of like CPT, that helps, again, with, we're getting at how it affected you, not necessarily what happened. So those are really my favorites. There's all kinds of methods out there.
Right. So it's important for veterans to know that therapy these days is a little bit different than it used to be. Back when they first started treating PTSD, where they don't necessarily have soldiers just sit and recap the story to where it's re-traumatizing them.
Yes.
So, you know, there's different models, like EMDR is probably one of the most common used to treat and doesn't involve rehashing the story. So that's an excellent resource for those who are looking for a therapist and what type of strategy might be a good fit for them.
Right.
So, so you gave us some excellent resources on how to find a therapist in their area. And of course, they can always just do a Google search, right? You know, therapist in blah, blah, zip code, that PTSD. And if somebody wants to work with you, how can they find you?
They can find me at KatherineMCounseling.com. My number is 817-757-3728, and I answer those calls myself, so they're not going to reach a receptionist or anything. It's going to be me. I will add that even if they're not in my area, if they need help, they can call me, and I will try and hook them up with somebody in their area that can help them.
And you're in Texas?
Yes, I'm in Arlington, Texas.
Perfect. And even if they're not in Texas, they can give you a call and you'll help them, connect them with another therapist that can help them.
Absolutely.
Excellent. Excellent. Well, thank you so much for being our guest today to talk about PTSD for our armed forces. And again, if you are a member of our armed forces who is sitting here watching this video, thank you so much for tuning in and thank you for your service. And there will be information, some of the links that we talked about will be listed in the description for this video, as well as Katherine's information. And of course, thank you for tuning in to wehearttherapy.com. Make sure you check us out on the web and stay tuned because more episodes are on the way.